So a very good afternoon to everybody. We'll take the good fortune of starting on time because this is going to be a little long session. We have a lot of speakers, and it's supposed to be a fairly comprehensive session. The session is titled "What After Residency," but there is going to be a bit of a spectrum, and it's going to cover some of the topics of residency and post-residency fellowship and international examinations and some offbeat topics that don't include the conventional academic route. This instruction course has actually been an invited course for the last 7 years, so we're very grateful to the All India Ophthalmic Society for having us back this year as well. And I hope it'll be of interest to all of you. Since we have a lot of speakers, in the interest of time, we'll start, and it's my pleasure to invite Dr. Parthopratim Dr. Majumdar, who is a very eminent researcher, clinician, and resource for postgraduate education himself. He's based in Shankar Nethralaya in the Department of Uveitis, and I invite him to talk about resource options for training in ophthalmology.
Yeah. Thanks, Deb, for having me here. So I'll be talking on resource options for training in ophthalmology. So first, I don't want to discuss this because there may be some bias and I may be, so just I'll skip that. So yeah, first if you talk about any resource, if you just train your mind to learn from the best. So the best option is you make a habit of searching the PubMed and try to read the PubMed indexed literature and whatever information you have. And then coming to one of the most important resource you can access is that one network. Sometimes you may actually skip that, seeing it's actually hidden in the member zone. And this one network has a lot of this thing. You can access some journals also. And the most importantly, you can actually test your knowledge and you can go to select a lot of subspecialty options are there and you can take exam. Like you can see here, the list is long. So these are the format that each question will have 4 answers and you can actually click the answer, and after that you can actually join the discussion also. Then we have a series of practice pattern guidelines, so which you can access from one network. And similarly, there is a section on the case discussion. So there are various interesting cases which has been discussed by the eminent ophthalmologists. So you can actually access them. And this is a very popular and very old website, that Success in FRCOphth, and I think many of you are familiar with that. So now another important, interesting website is that from University of Iowa, that iRound. So it has dedicated case presentations, atlas, videos, and all. And you have the gonioscopy.org, which is also a very good website to learn and understand the gonioscopy. And there are a lot of videos in challenging cases, troubleshooting, and how you should do a proper gonioscopy exam. Then there is another Stone Rounds. There are a lot of cases, interesting cases, and discussion there. So you can actually see them and listen to some of the additional podcast also. Now coming to this site, it's actually very good, this initiative by the cyber sites. And here you can see there are live webinars, and the most interesting are the online courses. So they have a module, various module. For example, they have fundamentals of SICS, 12-hour online course. So you can actually go through this module. And finally, after that, you can actually take a test also, and they will give you a certificate. So their modules are very interesting. As you can see here, they talk about, there are dedicated video on cataract basics, how history taking should be done in patients with cataract, how screening for high risk is important, and dedicated section about intraocular lens and everything. So, and then it also details, there are text materials also, which you can actually read. And you can see there, this is such a nicely done, like deep set eyes, what are the possible problems or difficulties you face, and what are the action you should take while prior operating these cases. So next is that the cutters, there is a very good website on the retina specialist. It's that superheroes of retina. And these are the podcast and medical retina, surgical retina, everything is discussed. And also there are some, now this audio podcasts are actually getting very popular. So you can go through this site, that Eyes for Ears is a very dedicated site. And there are, this website is very interesting, those who want to learn the OCT. So these are the dedicated website for OCT cases. Each cases are there with interactive discussion and detailed explanation. So I'll just skip that. And this is by one of the another ophthalmologist, the I Learned. So it's a very good site, especially for the previous year question paper, and useful site for the postgraduate students. So then we have the ecolab.org. You can see the various discussion and the interesting this thing. And we have also iFocus online. So you can see series of lecture, and there are lot of other YouTube resources. We are not going into details. This one is a very good website, YouTube channel from the neuro-ophthalmology legend, Dr. Andrew Lee. So I'll just conclude my talk with that. So you people are using a lot of chat GPT, Grok, and so many other options are there. If you have not used it, you can use this, that perplexity.com. So it's a very, very nice website. It's the only difference with chat GPT and other resources that it gives you that references. So for example, I have just searched this one, and see they are giving the references, that 2 PubMed references has been cited. So you can actually quote the references, unlike ChatGPT. So it gives you the option for that. Thank you.
Thanks, Partho. Very concise and nice present. Partho, I invite you to come up. I invite our other co-instructors because I think there's paucity of space. So if the co-instructors take up their space over here, audience can also be accommodated. Dr. Ashwin Gandhi, Dr. Meenakshi. Dr. Meenakshi's presentation is next. I invite Dr. Meenakshi Swaminathan. She is the former director of academics at Shankar Netralaya, a world-renowned pediatric ophthalmologist, and most importantly, an educator at heart. And she is going to talk to us about what to look for in a fellowship program as one enters. Partho, please come up. Dr. Devesh.
Good afternoon. Right, this was the title given, Entering Fellowship, What Do Course Directors Look For? I thought I'll talk also about, before entering fellowship, you got to go through fellowship interview, right? So let's talk a little bit about what that involves. So, no financial disclosure. So I was looking at it as 3 stages: preparation, presentation, and performance. So this was 2020 pandemic. Most of us were sitting at home. Hospitals were closed. So I took up cooking, and I got really carried away. Then slowly I would call small groups of friends to come and eat and sample my food and all that. And I started photographing like crazy and putting on Instagram. No recipes and all, just photograph, okay? So those are some of my creations, okay? And this is not a quiz. I'm not going to ask you what are these dishes. But that got me thinking, it's the same for food as for interview. How is it the same? So imagine food. I'm going to throw a party. And what preparation I have to do? For cooking, I have to get fresh ingredients. Okay, all have to look nice and fresh and all that, healthy. I have to look up the recipes. I also have to note down what is the date I have invited people, what are the time I have asked everybody to come. The same way, before the interview, make sure you note, especially you have 3 or 4 interviews lined up, make sure you note the date, time, venue of interview, read up on the faculty of the department and their interests, what is the latest research going on in your field of interest, revise the basics, nobody will forgive you if you don't know the basics, And of course, look at the common conditions and open an atlas and look at some of the photographs, especially if it has been some gap between your passing the DNB or MS and then going for interview. And please update your CV. So we come back to the dinner. Morning of the dinner, what do? We have a checklist, right? Did I, wipe and get the glasses ready, the plates ready? Do I have enough bowls, enough cups, etc.? Do you clean the house? It's all important. Appearance is so important. And then you also have a head count of people who are coming, and then, what is your food preferences, etc. Similarly, before the interview, arrive the evening before. I know a lot of people will come running that morning, take an early flight, disheveled, try to get there by overnight train, train will be late. No. Avoid excessive food or alcohol, get a good night's sleep, calculate time to get to the venue, arrange all papers and documents so you're not fumbling through them when I ask for something, book a cab, okay? Set out your clothes the night before, and you may think, what is this? All common sense. Why is ma'am saying this? And I have, if I have time, I have an example for each one of these, okay? Keep a double alarm or ask the hotel to wake you up, okay? So now the dinner has come. The dinner actually is happening, and the presentation. Look at that. That's a lowly rasam. Well, not lowly rasam, but it's in a short glass. And this is a very uniform, white-looking sabzi, but I've put it in a red bowl for contrast. And look at this. I want to show it's made with banana flour. So I don't do any of this anymore. Huh? This was all COVID. I had lots of time to do all this. And so you see the banana flour there and so on. So appropriate attire. Okay, well-groomed. Should you shave? Should you trim your beard? There are some institutes where a beard is not tolerated, I hear, nor is a mustache. So, be vigilant. Do your homework. Don't wear a white coat. You're not going to see patients in the interview. I'm not going to ask you to see patients, right? Should you wear a suit? It's a very mixed thing. Some people like to wear a suit. They think they have some more professional appearance. For me, when it's 36 outside and you come in a suit, I'm thinking, what? Okay, so... Also, beware of body odor, chipped toenails, half-removed nail polish. Believe me, I notice everything. At least I used to. Because if you're a pediatric ophthalmologist, most of your information comes from observation. You cannot go near the patient. So you really, and I'm a bird watcher in addition. So observation. That is what, so you notice everything, okay? Arrive early. Don't do excessive. Somebody will try to be very friendly with the administrative staff and go ask them, did you have breakfast? Don't do all that. It's very annoying. And don't skip breakfast. Stay hydrated. I'm feeling so faint. Not going to get you any brownie points. But ultimately, it's the performance, right? So it's like we say, the proof of the pudding is in the eating. So it's the performance in the interview. Correct, appropriate greeting, body language, content. Finally, you have to answer the correct questions, correctly. And taking leave. Goodbye. Should I wait for the results? Will somebody tell me outside? This is the right way to take leave as well. Okay. So I'm going to give you a few illustrative examples to say how each one, behaved during an interview. This was Dr. Dream Job. Because our institution used to have a peripheral branch in Rameshwaram, really the southern tip of India, okay? And if you go there for 6 months, you will be given a lot of preference or sometimes just handed the fellowship to you. So this person had finished 6 months and sauntered into my room. And I was interviewing for pediatric ophthalmology, and he said he wanted pediatric ophthalmology. So I open his CV and I find I am passionately interested in vitreoretina. I said, sir, doctor, are you in the wrong interview? No, ma'am, I forgot to change CV. I just thought it would. That doesn't look good, right? And then this is another, doctor who did not answer a thing, but quickly noted who was interviewing next to me and was very coy during the whole of the interview, doing this. And I don't have much hair and it's all gray, but you know what I mean, all that. No, don't do all that. That's all very annoying. We don't, in fact, I don't make eye contact. I'll be looking at somewhere listening to the answers, right? So that's what is important. This one was really a red flag, okay? So this was a male doctor interviewing for oculoplasty. The HOD was interviewing. And I had just stepped out and I walked in. And then this candidate never made an eye contact. Did not even notice somebody, and I used to be at least 10 kilos or more, Didn't even notice and looked in my direction. We sat there, I asked questions, but he would answer to the other doctor. And then while leaving, and then after some time, he went back in the sofa, one leg over the other, I'm wondering who's interviewing who. And then after some time, while taking leave, again said goodbye and thank you to the male doctor. I'm thinking, after the HOD, all the other assistants are ladies. How is this man going to listen to any of them? So obviously we didn't pick him. Okay. Anyway, now congratulations, you're entering the fellowship. So remember, hospital duties, roles, the medical superintendent, director, academics will tell you, and you will learn all about it from the seniors, or there may be a manual, or their orientation that will happen, or the secretaries will tell you. Fellowship duties and roles, the fellowship course director is the one you report to. The seniors, again, the department manual and a curriculum. Hopefully a good fellowship will have a curriculum with resources that they will hand to you during orientation. And the next two slides may look boring, but they really are the meat of the stock. So what is expected of you as a fellow? Well, clinical training and patient care. Hopefully you will engage in good, direct patient care. You will be doing surgical assistance and participation, running subspecialty clinics and emergency and ward rounds, and research and academics. You will take up research projects, teaching and mentoring the postgraduates or the medical students. You will attend academic meetings and conferences and journal clubs and do presentations, publications. You will maintain a logbook and be involved in administrative tasks as well. And like say, maybe you have to give a case summary for patients, right, of your consultant, and be involved in continuing education. And let me go to the last but one slide. But paramount important, patient safety and quality improvement. You will be conscious of that. And you'll coordinate it for patient-centered care with other departments, other hospitals. Patient needs to be sent for an MRI. And if the patient is just lounging around and fumbling around and the fellow is responsible and nothing has moved, you do note that as a fellowship director. And you learn to work with limited resources. You're not going to be may not be in a big institution when you leave. You need to know how to work with limited resources and not start writing all kinds of diagnostics. Evidence-based practice, reflective practice, and commitment to personal growth. What did you learn in the last 1 week? You should be able to think about it and talk about it, reflect about it. The last two, very important. And as a fellow, do you demonstrate professionalism and ethical behavior, accountability and consciousness, self-awareness and help-seeking? When you don't know, do you know to ask? I don't know. I think I may have missed this. It's okay. You're in training. You are allowed. You should ask all these questions, okay? Somebody is there to help you out. Someone is there to take care of you. And interpersonal communication skills. Are you good at patient and family-centered communication? Interpersonal and interprofessional and team communication. And finally, are you good at medical record keeping? Both handwritten records and EMR. And are you irresponsibly sharing, I did this TOSI surgery yesterday, look how good is the outcome on WhatsApp groups. Okay, all this is important, okay? So that is why, years ago, during the first day of orientation, I went home and found the resident had actually sent me a Facebook friend request. I was shocked, okay? I was like, how dare you, But then I thought about it. You know what? It's one way I'll keep an eye on you as well, huh? Just as you will find out about me and the birds I watch, I'm also going to see which birds you're watching. Yeah, so it's good. So in conclusion, as a fellow, you're the torchbearer of the institution. And this is my own quote. It is through my students and sharing my knowledge, I become immortal. So that is how important fellows are. Thank you so much, Devendra, for this opportunity.
You're most welcome, ma'am. Thank you so much for being with us. Any quick question for Dr. Meenakshi, because she has another commitment in another hall. We can take that now. Okay. Thank you so much, ma'am. Thank you.
So next we have Devendra, who is going to talk about nuts and bolts of FRCS. Devendra is the chairman of Lakshmi Eye Institute in Bombay, which is part of Center for Sight now. And he conducts the revision course for FRCS, FRCO in Mumbai.
Thank you so much. And I'll be briefly taking you through the nuts and bolts of the FRCS examinations. We can project it on the main screen. Yeah, thank you. So this is just a background. These are the Royal Colleges. The one in Edinburgh is the oldest, followed by the one in Glasgow, and the Royal College of Ophthalmologists in London has their own parallel examination, which will be covered by other speakers. So I'm going to be focusing mainly on the second one, which is the Glasgow College. The Edinburgh, unfortunately, flips and flops with regard to their examinations. Currently, they're not made available. But let's start with the Glasgow examination. It's a really old college, and these are some scenes from Glasgow where we visited after the examination for the convocation ceremony. This is a very important part of my talk. I always have this slide because that's Dr. Asif Virani from Thane, who was my study buddy for this examination. And it really helps to have somebody you can bounce off your preparation with. So I think that's the first and most important tip that I'd like to give anybody giving this examination. These are a few scenes from the convocation. It's a very prestigious and ceremony full of pomp. But let's get back to the basics before we reach that stage. The examination has 3 parts, and I'm sure many of you must be familiar with this if you're thinking about giving this examination. Part 1 is basically the basic sciences and optics, and it's an MCQ paper for 2 hours. The second part is clinical sciences, and again, it has now been condensed into a single part, which is MCQ based. Earlier, there used to be a long answer question of 4 parts, which has now been done away with, and it has now only a single MCQ paper. And the third part, which is the meat of the examination, is divided into 2, which is the structured oral examination, also called the vivas, and the clinical examination, which is where you see patients. So there are 3 and 4 stations respectively. Now, who can give this examination? For part 1, anybody can give the examination. You just need to have finished your internship. You don't even need to be in ophthalmology training. And for part 2, you need to have completed part 1 and 5 years of post-qualification training, which includes your internship. And you should have spent 54 months of that in clinical ophthalmology. And for part 3, you need to complete parts 1 and 2. These are the fees. These are the latest fees, and they increase by almost 10% every year. And initially with Brexit, there was a depreciation of the pound, so it was a little cheaper for Indian candidates. But now the prices are really picking up, so it requires a lot of financial planning apart from your academic planning. So otherwise you end up with a really big headache. And the website says you have a maximum of 6 attempts for each part, but I think before that 6th attempt, everybody will be on their deathbeds, because it's you have to wait literally a year before you can reattempt. And just for an example, these are the latest fees and dates for the 3rd part, and you can see that 3 out of the 4 centers, actually there's a center in Bangalore as well. So there are 3 centers which are in India. So you have an opportunity to give this examination in India. So this is the website which will give you all the details, all the curriculum, the methodology, the dates, times, fees, etc., and how to apply. To touch upon the examination itself, it uses what is called the modified Angoff technique, which means that there is no cutoff predetermined pass mark. For our DNB or MS examinations, we have to get 50%, or we have to get 30%, or we have to get an X%. Here, the examiners will evaluate each question and divide it into whether it's an easy question or a difficult question. If there's a majority of difficult questions in that paper, the pass mark is lowered, so more people can pass. Whereas if it's an easy paper, then the pass mark is much higher. So that's how the examination is done. So it's very objective, very well structured, and there's less bias, which is, I think, the real reason that attracts many of us for these examinations. Very briefly, what are the sort of resources for this examination? These are what I used now more than a decade and a half ago. But for optics, I really depended upon Elkington and the lovely textbook by the late and dear Professor Khurana. For the MCQs in basic science, indispensable is John Ferris, and the Eye by John Forrester is also an excellent resource, although it's quite voluminous. For the clinical parts, the MS and DNB syllabus is your core, but you can also try to test your knowledge with this Mass Eye and Ear Infirmary Review Manual, originally authored by Jeffrey Lamkin, but now with a group of editors. There are sections on emergency medicine, so I depended upon the Oxford Handbook of Clinical Medicine. This used to be the sort of gamut of scenarios that you would be faced with or tested with. And this is from the website, where they wish you to be able to assess situations, establish a preliminary diagnosis, and sort of stabilize a patient's condition before you refer the patient. And also some aspects of arrhythmia and ECG. I've deliberately put that in because it's something that we have either overlooked, which is why we ended up in ophthalmology, or something that we have now deleted from our memory banks. So general medicine and neurology is tested both in parts 2 and 3. And these are the sort of spectrum of conditions, those which have ophthalmological signs and symptoms. your initial stabilization and investigation prior to referral, treatment of certain life-threatening conditions, and medical emergencies. So a few tips. This entire examination is extremely practical. You know, even in the theory exam, they're not testing your theory. They will not ask you the percentage incidence of a particular disease and give you 4 options. There is a very methodical manner of approaching the question, and there is a planned answer, and generally the schema flows from something that's life-threatening to something that's vision-threatening, and lastly, something that would be of only cosmetic interest. So coming to the third part, as I mentioned, the structured oral examination is the first one that you will encounter. It has 3 stations of 20 minutes each, where you would be quizzed upon these various topics. You will have 2 examiners, and it really goes in a very fast manner. But it is very structured because it has specific questions and model answers. And if you're able to hit those keywords that the examiner has on the card in front of them, you will do well. Generally, the examiner may wait for you to make a mistake before they guide you, and they do guide you to get back onto a correct path if you are totally off track. There are subparts to each question which builds on your previous answer, so you need to at least start off correctly so that you can be asked the second and third subpart. The clinical examinations is probably the more nerve-wracking of the two, because here you are faced with actual live patients. You have very focused examinations that you need to do. There is there's no history taking that you really need to do except in hindsight, but your examination technique is what is being tested, as well as your bedside manner. So these are 2 things that we overlook in Indian examinations, and this is what is exactly being tested in this. You have 12 minutes at each station. Again, you have faced with 2 examiners. And in general, you may see 3 or 4 patients per station, which means that you end up only examining a patient for 3 or 4 minutes. So you can imagine how focused your examination needs to be, and how fluent your answers need to be, or how fluent your description needs to be. I think that is the key of the examination. Try to practice fluency. Even if you imagine a particular case in your mind without having that patient in front of you, you can go through that with your study buddy and try to describe that examination while you are just imagining it in your mind. Practice pays, and there are certain advantages. I won't go into these because these are really dependent on the whims and fancies of the government at that point in time. But in general, FRCS allows you direct registration with the GMC. You do not need to give the PLAB, which I think all of us would consider a significant advantage. There is certain exemption with the ICO, especially parts 1 and 2A, if you've given those examinations. All of us who are interested in these examinations probably like to give examinations, and many of us are giving it only to add to the tail ahead of our name. I always put this slide up. It's a great, a tribute to this gentleman who has, whose degrees don't seem to end, but we don't need to go to this extent. But I think we are all proud of the added initials that we can add to our name. There are certain disadvantages, and I would warn you that they are expensive examinations, and they are not licensing examinations. Just because you've cleared the FRCS does not mean that you're eligible for a job in the UK or in the Middle East or anywhere else. You need to look for the specific national guidelines, and obviously in India it is still not considered a valid degree in ophthalmology or super specialty. Sorry. So these are just a few images of the course that we've been conducting at Lakshmi in Panvel over the last 6 years, and after a hiatus due to COVID, we are back, and we invite you. You can take down these details if anybody is interested. These are focused, this course is focused on the third part, that is the practical part, and we would have sessions generally in August or September before the actual examinations. I wish all of you giving these examinations all the very best, and even those of you who are not giving the examinations all the best. And I now hand it over, because I think we're short of time, so we'll have our next speaker. Our next speaker would be Dr. Pranita. Yeah. So Dr. Pranita is now associated with the All India Institute of Medical Sciences. She is a prolific examination giver, and along with her husband, Dr. Devesh, and she's also very keen on ophthalmic education. So we invite her to talk to us about the ICO, FAICO, and subspecialty fellowship examinations.
Thank you, Dr. Devendra, for that kind introduction. So I'm Dr. Pranita, and I'll be talking about FICO, FAICO, and the subspecialty exams. I think these are one of the most popular exams, especially in the Indian setup, that the students are appearing for. So once you enter the post-graduation, life seems to be all set, because from MBBS, clearing and getting an PG seat, and especially a surgical branch, it seems like that is it. Nothing more is needed. But just a couple of months and you realize that that's not it, you need to do more, and then you need to decide what you need to do, whether you want to stay in India, because the opportunities for good fellowships or good senior residency where you get a good surgical exposure is limited. So that is when you start thinking about whether you want to go abroad, do a fellowship there, and which exam do you want to go for, which certification course is going to give you that extra edge over and above your peers. So we have a lot of international exams that we'll be covering up today. I'll be talking about ICO. The International College of Ophthalmology, it consists of various steps of exam. So the steps are 4 steps basically. The part A is visual sciences, part B is optics, refraction and instruments, part C is clinical ophthalmology, and the final step is advanced examination. Unlike other exams, you can appear for both part A and part B together in the same sitting as well. Together, the part A, B and C are known as the standard examination. And once you have cleared the standard examination, that is the first 3 steps, there is an advantage that you can also become eligible for the final step of FRCS Glasgow, which is the final clinical exams or the Viva practical exams. So that's the advantage with the ICO. It also allows you to appear for the FRCS. However, you need to understand the FRCOphth is completely separate. You do not get any such exemptions from the ICO exam for the FRCOphth. Once you clear the advanced examination, you have the advantage of not just using the post-nominal acronym of being an FICO, but other advantages that we'll be discussing subsequently. So the part A, visual sciences, tests your basic knowledge of anatomy and physiology, all that you read about as soon as you enter your post-graduation. But in addition to that, it also assesses your knowledge of neuroanatomy, epidemiology, statistics, pathology and microbiology. So you need a basic knowledge of your MBBS as well when you're appearing for this first step. This is an MCQ based exam. A total of 120 questions are there. And it's a four options. You need to select the single best answer. No negative marking, a 3-hour exam. And what you need to read is the basics of AIOS series, Anatomy and Physiology of Corona. And even the book by John Ferries is very helpful. It's a self-assessment kind of book in a question-answer format, which you can read for the Part A and Visual Sciences. And you get a certificate in the end once you complete this exam, which can be the passed with merit, or passed with distinction. The next part is part B, which deals with optics, refractions and instruments. And this is also an MCQ based exam, 60 MCQs, no negative marking, a 1.5-hour test, which you can club with the part A as well. And a book by the Clinical Optics by Elkington, the Chua Optics, Duke Elder, and Optics and Refraction by Khurana is good enough to clear or crack this exam. Again, these 3 certificates, you can pass with these 3 certificates. The next step is clinical ophthalmology examination, which tests your entire knowledge of ophthalmology, something similar to your final postgraduate exam. Just the difference that this is not a theory exam. Again, it's an MCQ based exam, 200 questions, no negative marking, a 4-hour test. So the book by Kansky's Clinical Ophthalmology and American Academy of Ophthalmology are good enough because the questions are mostly on to basics. It is not something based on advanced research, but basic of ophthalmology and the entire subject of ophthalmology is what is going to be tested in this step. The final step is advanced examination, in which it is more of the practical application of the theoretical knowledge that you have read about for your post-graduation is what is tested. Again, it's an MCQ based test, but you also have extended matching questions in which you may have a case scenario, and on that base case scenario you may have 3 to 4 subsequent questions. So you have to be able to identify that particular clinical diagnosis to be able to answer all those subsequent steps correctly. There is no negative marking again in this one, and total time is 3 years. And the books that we just discussed in the clinical sciences is again good enough for advanced examination, but with a more practical approach. So when to appear is an important decision because you don't want to waste time. There are 4 steps. Obviously, you're going to appear one after the other. So For the Part A, immediately as you enter the post-graduation, it is good enough to appear for this test because you're fresh with your MBBS knowledge, which is also a part of this step that will be tested. The second step by the end of your first or second year. The third step by the end of your post-graduation. And advanced is best after you have completed your practical exams of your post-graduation. This is the website from ICO, which gives you details of all the centers. You have a lot of coordinators from India as well who are coordinating these exams, and you can contact all these exam coordinators. The dates are updated on the website time to time. They are conducted every 6 to 8 months. The next exam is going to be conducted next month, the date for which is already closed for application. So you can watch out the website for the next coming date. And again, the cost is something very important. Every step is expensive. A total of 1.5 lakh is what we are looking at if you are going to appear for all the 4 steps. And the exemptions we have already discussed. If you complete all the 3 steps, the first 3 steps, that is a standard examination, you can directly go for the FRCS final step. The other advantage is it does give you an opportunity for short and long-term fellowships abroad. So these are basically fellowships with scholarships that comes, which is advertised on the website also. You can have a 3-month or a 1-year long fellowship. With a 3-month fellowship, there is an incentive of around $6,000 to take care of the expenses, your travels for the fellowship. These are the various specialties in which the fellowships are offered, and you have a detailed list of all the international hospitals and medical colleges which provide fellowships in particular subspecialties as well, which you can look into when you are applying. Now that was about ICO, something about the subspecialty exams. So nowadays, just doing a fellowship into a subspecialty may not be enough because that does not add on to your actual affiliation, right? And whenever the patients come to you, you have a post-graduation degree, you may have done a fellowship in 3 years. For example, I was in practice and one of the patients came and he said, you are a cornea specialist, but there is nothing to add to your name in the degree. So you need to justify even a fellowship that you have done, which you can justify with these subspecialty exams, which you can add as an acronym to your name. So the All India Association of Ophthalmology has come up with this subspecialty exam, which they are running for almost 10 years now. And they are one of the cheapest fellowship exams all across the globe, at which comes at just a cost of 10,000 rupees for each exam that you appear for. Okay, so these are the subjects in which you can appear. And at one time, you can appear for only 1 course. And at maximum, a candidate can appear for 2 subspecialty exams. This is again an MCQ-based exam, a 1 hour 60 MCQs. That's the first step. If you clear that, the second step is your practical viva, wherein again you have 2 parts. One is the OSCE, in which you have 10 OSCE questions based on clinical condition, clinical pictures, scenarios, and then you ask questions on that. And you also have a separate viva on it. Once you clear both the steps, that is when you get the FAICO fellowship. So as I told you, it is just at a cost of 10,000, but you need to be an AIOS member. You need to have a basic post-graduation qualification in ophthalmology, minimum 2 years of experience post-graduation, and minimum 18 months of exposure into the particular subspecialty that you are trying to appear for. Even if you do not have that, even a 3-year practical work experience, even in your practice, is good enough for allowing you to appear for this exam. So it's a long roadway, multiple steps. So plan well in advance because you don't want to waste time as well as money for it. And there are limited seats, limited slots that come up for these exams. So plan well ahead in advance. And I'm sure you're going to do well. With that, I would like to end. Thank you.
Thank you, Dr. Pranita. So, I won't say it's been a waste. Dr. Devesh Kumawat also is our next speaker, and he's given all of these examinations, and we're very happy that he's staying back in India. But he's going to talk to us about the licensing examination for the UK, which is the FRCOphth, when to start and how to excel. So, life takes you on different turns, and he's a prime example. So he'll talk to us about this examination.
Presentation.
The audiovisual team, can you please help us?
So while that is being loaded, if there are any questions for the preceding talks, Dr. Partho's talk on resources, on the FRCS examination, or on the ICO examinations, we can take them now.
Yeah, please go ahead.
what I would like to add is with the FRCS Edinburgh and Glasgow, you get the registration to the GMC, but if you want to progress in England to become a consultant, you have to do a FRCOphth. So my suggestion is that if you want to do a fellowship, do a FRCOphth. So then you get all the advantage, you get the registration, etc. But you get all, then you can progress within the UK as well. So everything that the previous two speakers said is valid, but consider doing a FRCOphth as your first option. And there are 3-4 exams, Ireland exam, Irish exam, they're all similar. So if you prepare for one little bit of difference, maybe 5% of difference. So aim for FRCOphth.
Yes,
So
we
that's
left
the
the
message.
best talk for the last. That's why, we probably went in a sequence of basic to something that's more
So
advanced.
I didn't know about this. My senior colleague brought me here. I'm thankful to him. We have a talk with my colleague Sanjay Chaudhary tomorrow morning from 8 to 9:30, the whole session, about training opportunities in the UK. It's hall 303. So if you're interested, I mean, all you're interested, that's why you're here. So come to that talk, and then we will discuss a bit more detail about how you should prepare. Adding to what
Thank you.
Everything what you said is all applicable. But
Thank you.
Absolutely.
experience, the
Yes.
actual you have to do what's
AV
not-
team, can you project the...
So our next speaker, because we will move on to the next topic while that presentation is being located. Dr. Akshay Nair is going to speak to us on surgical training opportunities abroad. Dr. Akshay is a prolific and very erudite oculoplastic surgeon and researcher, and he's had this wonderful opportunity, and he'll guide us on these sort of special niche opportunities that one may try to avail of. Akshay, over to you.
Thank you. AV team, can you
Project
the
the
project.
slide, please.
Right. Thank you. So one of the things that, just a show of hands, how many of y'all are in training or within the 3 years of having completed training? In residency, in PG, or within 3 years of having completed? Okay, so that's good to know that this is the target audience whom we are talking to. So wherever I have had residents who want to ask me about going abroad for training, I ask them why, and these are the most commonest things that I get to hear, because presumably they would, they think the training abroad is better, it's more cutting edge, they have better research opportunities, and to find out more niche specialities that they can get into. More often than not, it's a stepping stone to moving and shifting base and living in another country, working there and moving there permanently, immigrating. In case they want to come back, it's just the prestige of having trained at a better institute abroad to increase your networks, to connect better. So if this is one of your motivations to think of training abroad, then it's possibly good. When should you not consider moving abroad or training abroad, or when things that you need to reconsider is when you're not sure what you want to learn by going abroad. If you've just completed residency here and you haven't done a subspecialty fellowship, and you want to go ahead there to do a subspecialty fellowship with the aim of coming back to India and practicing, or you just training abroad and doing an international fellowship, but planning to settle abroad, well then try to go the conventional route. So I'll cover a few places, primarily UK, US, a couple of other places, and the organizational support fellowships that we have, which is the ICO, the Ophthalmology Foundation, the APSOPRIS, the APAO. So a good starting, if you're, and I'll say this 2-3 times during my talk, the best time to have started your preparation for a fellowship abroad or for moving abroad was yesterday. The next best time is today. So you may be in your second year of residency, but in case you want to move abroad, you need to do the groundwork now so that you can put the ball in motion. So a good starting point is to look for jobs on the NHS job search website, where you can put in a specialty, put in a location or not, and just hit search. You'd end up getting places where you have, say, a vacancy for a senior clinical fellow with an international oculoplasty or a specialty doctor. You'll also have openings for fellowships. Similarly, each of the hospital websites, say like the Move Fields, will also have their listings for openings for fellowship, especially if they're looking for an international fellowship. You can click on all of them and they'll tell you
what is essential, they'll say that GMC registration is essential. And as Sir and as Dr. Rashmin and Devendra have all mentioned, FRCOphth is required. FRCOphth is desirable, primarily because that's how you'll be able to practice there. So how do you go about doing your getting into the GMC? The first thing is your EPIC verification, which is the electronic portfolio of international credentials, which is an electronically done thing where your medical license or medical degree is verified. You always, regardless of whether English is your first language of proficiency, you will still need a certificate of English proficiency, preferably the IELTS or the OET. And then is the PLAB, the MLE or the AMC, your licensing exam, which your FRCOphth helps you avoid or helps you not have, it's no longer required. If you've cleared your FRCOphth, you're exempted from PLAB. Or if you've got the USMLE, then great. So, which means that you have to do this. As he mentioned, what FRCS Glasgow does is that it allows you to be registered in the GMC, but you have to go through the CESR CP pathway, which is something known as the Certificate of Eligibility as a Specialist Practice in the UK, which has a separate pathway in which you need to get that. There is also a route called the FRCS MTI Dual Scholarship. Now, the Royal College of Ophthalmologists has a dual sponsorship scheme, which allows international medical graduates to undertake specialty training there for a limited period of time, specifically 24 months. Now, dual sponsor means that someone from the college end or the UK would be one of your sponsors. Someone from India would be one of your other sponsors. When they say sponsor, they don't mean paying money for you to go there. It means vouching for your training and credentials. Now here, by virtue of having done your FRCS, the Royal College will act as one of the sponsoring body from there, and you will need a mentor or a person who's vouching for your skills and knowledge and proficiency to be the other sponsor from here. The sponsor in India will also attest to your skills. There will be an interview from both ends. You need your letter of recommendation. And then this is valid only for a training period of up to 24 months with the intention that you're expected to come back to your native country and work. However, there is a possibility that should you get a better opportunity, you can switch over to a tier 2 visa, which is a work visa, which then could allow you to settle there for a longer period of time. So that is a general overview of how you have opportunity. So basically, if you need surgical training in the UK, you have to have cleared your licensing exam. Observerships, short-term observerships, clinical observer, research observerships can be directly applied to the hospital. Remember, you're not touching or operating patients in those clinical or research fellowships. So those are allowed for you to apply without getting your licensing exams. For the US, in case you're looking for, again, surgical training, there a residency requirement is absolutely mandatory, for which you need to have cleared your MLE in all 3 parts. However, the license to practice can be given by certain state boards, state medical boards, such as California and Louisiana, and a couple of others, I think Kentucky also does, where international foreign medical graduates, on the recommendation of the university or the hospital, can issue temporary practicing licenses to them, which is why in California there are multiple surgical training programs where international trainees can come in and get hands-on training, such as these prominent programs for oculoplasty in the University of California, San Diego, and University of California, Los Angeles. Singapore, there are 2 primary institutes that offer long-term and short-term fellowships. Long-term fellowships are available at NUS, that is the National University of Health Singapore, for international candidates. SNEC, the Singapore National Eye Clinic, offers only short-term clinical fellowships. These are fellowships that are directly applied for at the institute. They would interview you, and based on the process of recommendation of the interview board, you're offered the position. They would then give you a temporary licensing registration, which allows you to operate under supervision, basically as a trainee. But for this, you need to have completed your residency in India, preferably have a Royal College certificate as well. So if you've cleared your FRCS, either Edinburgh or Glasgow, that is a plus point, but that's not mandatory. A simple MS or DNB holds good. You are, however, not allowed to continue practicing in Singapore. So these international temporary licenses are given to foreign medical graduates with the intention of coming back. Short-term fellowships range from 3 to 6 months with limited or no hands-on. Long-term fellowships can be 1 year, 15 months, or 18 months, where you are given surgical training under guidance, but are expected to come back after training there. Most commonly offered fellowships are cornea oculoplastics. Now, training options in RANSCO, in Australia and New Zealand are available on the RANSCO website, where they have you can look up if each of the hospitals and directly apply there. However, again, you need to be registered. You need to have the medical license there. The Indian medical degree is not valid, and you need to go through. They have a set of exams. Research and observation fellowships are available there, but surgical fellowship opportunities are incredibly rare. Like I said, some hospitals allow you to bypass these routes, and you can directly apply to them based on their availability on their website. Prominent ones being Moorfields and the Wilza Institute in Philadelphia, where they are willing to accept foreign medical graduates with limited hands-on training that is offered at their end. ICO fellowships, there are short-term 3-month, 6-month fellowships, as well as long-term fellowships, 1 year, in all specialties that are offered based on the application process, which is a separate talk on its own. The ICO exams, to have cleared them, is preferred but not mandatory. Again, if there are certain places with whom you have connected on your own, which are not in the ICO host directory, you can write to the ICO and say, hey, I have cleared my ICO exams. I want to do a 3-month observership or a fellowship at this hospital. They are willing to absorb me. They are not listed as a host on your website. Can I still go? They'll be happy to accept it. Things to remember before I conclude. Remember, most of these fellowships are rarely funded by the host. You need to get your own visa and funding in order. The timeline is most important. Most of these applications, from the time of application to the fellowship going live, is at least 24 to 48 months. So you need to plan 2 years in advance of when you're planning your fellowship, which is why residency is a good time to start planning, to build up your CV, to have publications and conference presentations. Even a poster or a video at any conference is good because that shows your commitment. Also, an option could also be going to the same institute and doing a short internship or observership just to dip your toe in the pool to see how it is and then go. Always meticulously maintain a logbook for your benefit. You never know when it is useful. Every case that you've seen in the OPD is not possible to record that, but at least every surgery done, every surgery assisted or observed. The AAO website has a global directory of training opportunities with over 800 fellowship opportunities, both short-term and long-term listed, and they are classified based on specialty, duration, and country. This is a YouTube talk which is uploaded by Dr. Anuj Soni, he has a popular channel called Clinical Peanuts in Ophthalmology. It is a very interesting video or a podcast where a lot of different people have given different points of view, essentially similar to what this panel discussion is. So I would strongly recommend that you also go and check this out. Thank you so much for your time.
Thank you, Akshay. I invite Dr. Devesh to give his talk.
Good evening, everyone. So I'll be sharing some tips and tricks about when to start and how to excel in FRCOphth London examination. So this is the website from where I have prepared most of my presentation. So you can visit this website for all the information. So FRCOphth examinations, it stands for the Fellow of the Royal College of Ophthalmologists London, which is a prestigious award of fellowship provided by the Royal College. And it constitutes of 4 examinations, and if you clear that, then you need to pay a membership fee, and then you become a member of the Royal College, and then you can use the post-nominal FRCOphth. And it is the exit exam for the ophthalmology trainees in UK. So it is considered as a very important examination of international stature. Now, the 4 parts, the part 1 is the written basic and the clinical sciences exam. And there is no minimum ophthalmic training required for this, for taking this exam. Even in your first year of ophthalmology training, you can undertake this exam. Now, earlier the route was to take the refraction certificate exam and then the part 2 written exam and then part 2 oral exam. That would be the 4th exam. But recently, for the last couple of years, there is a change that you can undertake the part 2 written exam before refraction certificate exam, and then you need to complete both the refraction and part 2 written exam before appearing for the final oral examination. Now, it is also for the refraction certificate, there is no minimum training that is required, but for the part 2 written exam, you need to have at least 4 years of ophthalmology training. Mind you, there are no exemptions in FRCOphth. There are exemptions in FRCS, but in FRCOphth, there are no exemptions. You need to appear for all the 4 examinations. Now, when do you need to start and how do you excel? You have to decide early. Like for all other examinations, you have to decide early. Residency is the best time because you have a balance of both the academics as well as the clinical work, and you'll be fresh with the knowledge. So just after the residency would be a great time, or during the residency, final year of residency will be a great time. Now you need to know, read and plan your studies accordingly as per the syllabus. And you, in addition to that, you need to have good clinical experience and skills because that will help you in the clinical examination session. Now, part 1 fellowship examination is an online proctored exam. So part 1 fellowship exam and the part 2 written exam are both online proctored written examinations of 2 separate examinations of 2 hours each with 90 questions in each session. And the paper is a theoretical paper which is based on the basic and clinical sciences which are relevant to ophthalmology and patient investigations. So although there is no minimum training that is required, but for the basic and the clinical sciences and patient investigation, I think the ideal time would be the 3rd year of residency because then only you'll know about these aspects. Now this is the syllabus that is given on the website also. And the important resource will be a basic and clinical sciences course by American Academy. In addition to that, you can read clinical optics by Elkington as well. Refraction certificate, it's a practical exam and it consists of 10 stations, OSCE stations, which constitute of 2 stations on simulated retinoscopy. There will be a simulator eye and you have to perform a retinoscopy on that. Then you have 2 stations on non-cycloplegic retinoscopy on patients. Then you have stations on subjective refraction, refinement of sphere, refinement of cylinder. And then you have, in addition to that, you have lens neutralization or use of phosimeter as well. Now, when to appear, again, there is no minimum requirement which is there, but you are unlikely to pass this exam without having extensive practice and experience in refraction. So for instance, I had to practice for nearly 2 to 3 months. Daily, I used to practice on 5 to 7 patients and do it religiously, do all the steps of refraction, starting from your objective to subjective and then binocular balancing in the end. So that is when you are able to do it accurately and within the time. Now resources, the last resource which is mentioned is an excellent and very concise resource that you can read, and it tells you how methodologically you have to follow the refraction procedure, and you should not skip any procedure that is mentioned in that book. Now most important again is the practice, irrespective of whether you read, unless you do it, you practice it, you're not going to clear this exam because you are not only going to be marked based on the accuracy of the refractive error that you diagnose at the end of examination, but you will also be marked on the high-end hygiene, rapport, communication, and time management in this station. For instance, in my feedback report, it was mentioned that while using one of the lenses, I did not clean the lens back, and I touched the central part of the lens, so that also goes against your marks. Now, part 2 fellowship written exam, it's again an online proctored exam with 2 sessions of 2 hours each, 90 questions in each paper. Again, it's a theoretical paper, but it covers the entire curriculum. The OST is the ophthalmic specialist training curriculum that is for the UK postgraduates in training. So it's the theoretical paper that covers the entire curriculum. It is same as the syllabus of MD and DNB or MS in DNB. When to appear, you should have cleared the part 1 examination and you should have minimum 4 years of training. An ideal time would be a fellowship or senior residency. Now, what is different in the syllabus over here is health promotion and disease prevention and continued professional and personal development. These 2 domains are something which the college pays very importance to these domains, and there is equal mark distribution and for these domains as well. So it's not only the basic and the clinical sciences and patient management that you need to be aware of, you need to be aware of these other domains as well. Now, Part 2 fellowship oral examination has two formats, as in the FRCS examination, that you have the structured viva and the OSCE. Again, the entire curriculum will be, you're asked to know you should know the entire curriculum. And again, you have to have minimum 4 years of ophthalmology training and should have cleared the Part 1 refraction and Part 2 written examination before appearing for this exam. Now, structured viva, the difference between FRCOphth and FRCS is that the first 3 stations remain more or less same, but you have attitude, ethics, and communication station as well, and you have an evidence-based practice, health promotion, and disease prevention structured viva station as well. Now, in the OSCE, you have multi-station video as well as clinical examinations. You have videos which are shown to you, which will be very focused on a particular finding or a particular disease, and you have to answer the questions that you will be asked. And then you have one patient in each station, and you will be asked to do a focused examination on those also. So you have different stations, and then in the last, you have a communication skills also station, in which you have to counsel a patient who might have undergone surgery and there was some complication, or you have to break bad news to the patient. So that communication skill session is very important, and often if you don't pay attention to that, then you might not pass that communication skill station. But it doesn't matter. Overall, you should not have red flags in most of the stations. If you have red flag in one station, then that can be covered by marks in the other station as well. Now, certain tips: you should prepare the content list and plan the time distribution in advance, like in any other examination. The go-to clinical books will be again Kansky and Oxford, or any other book that you would have studied for your MD or MS examination or DNB examination. For the topics that are different from our MD/MS syllabus, you can consult the Oxford Manual of Training in Ophthalmology for the topics on attitude, ethics, and communication, and health promotion and disease prevention. Now, RCOphth guidelines and current GMC guidelines are very important. They directly ask questions, not only in the theory exam, but also in the practical and viva. They ask directly questions from the guidelines. Ophthalmic investigations are paid very great weightage. There are very limited MCQ books or preparation resource material for FRCOphth examination. One of the MCQ books is by Darren Ting and David Steele. And then you have a Viva and OSCE book by Timothy Fung and Winfred. And these books are really helpful. Now, if you see the pass criteria, these examinations can have pass rate as low as 30% to as high as 70%. And it somehow depends on the place also where you are undertaking the examination. So if we see in the Indian setting, the examination, always the pass results have been on the lower side. And in Delhi, May 2020, the pass result for the refraction examination was as low as 39%. Validity, you have 7, you can take maximum 7 valid attempts could be taken, 6 attempts could be taken. It's a long roadway, multiple steps are there is prolonged interval between the exams, you cannot appear after giving the first examination for the next examination immediately. Limited centers which are there, but in India, yes, there are centers coming up in India, in Mumbai, Chennai, and now in Delhi also we have centers. And then there are limited dates, that is the seats. And this is the examination calendar. You can visit the website for that. The prices for these examinations are exuberant. And if you see the 2024 fee, in INR, it would be something around 2,56,000 for the last step itself. And for the second refraction step, it is somewhere around 1,15,000. So these are very pricey, very expensive examination, and you should think before starting to appear for these exams. Now, there is an annual subscription fee also. If you want to retain the post nominal, you need to pay this annual subscription fee every year to retain that nominal. Otherwise, the college sends you a mail that you can't anymore use the nominal now. Now, given said that if you clear this examination, you have a prestigious award that you get, and you have a prestigious, you have a very grand admission ceremony that happens in United Kingdom in London. So that is something that is very rewarding. And there are other benefits of doing FRCOphth as well, as Dr. Akshay has already told, that you get an exemption from PLAB, and then you can directly apply for CSER for registration as a specialist. there are certain exclusive benefits that are there to those who become a member, that you can have access to the iJournal and then one network, reduced fee for the annual congress that the Royal College conducts, and you can have an opportunity to become an examiner also in these examinations. So once you become a fellow, after a certain duration of clinical experience you can apply for being an examiner in these fellowship exams also. So the mantra for all these examinations remain the same. You should know the syllabus, you should plan it well in advance, and then there is no ideal time to appear, as successful people never stop learning. So if you want to do it, you can do it now also, but the preferable time will be in residency, end of residency, or just the starting of senior residency or fellowship. Thank you.
Thank you, Dr. Devesh. Very comprehensive. We are going to change gears now. We've talked about a lot of these four-letter examinations. Now I invite Dr. Ashwin Gandhi, who has been there, done that, and now is doing something new. And he's sort of going to hopefully open everyone's eyes to options beyond ophthalmology with an ophthalmic base. And I'm sure it's going to be very interesting for everybody to look at and think about.
Yeah, thank you, Devendra. So I would just take maybe 5 minutes to talk about, so because we have, I'm sure, a lot of questions and points to discuss. So I have broadened the scope of this talk with some of the things that we didn't cover in all the preceding talks, as to how do you really plan your future. You've completed your residency, you're thinking about FRCS, FRCO, or other exams, but are there anything else? I mean, questions like, do I really need to do fellowship? If I have to do a fellowship, how do I really choose my specialty? How do you really say that, okay, I'll be a good cornea surgeon or a good retina surgeon? So, once you complete your residencies where life is open 360 degree, till then, you've done your 12th, you've done your MBBS, you're going to do your MD, so it's like a straight line. And after that, suddenly everything is open. You can do cornea, you can do retina, you can start your private practice, you can go to government job, and that's where the dilemma comes in. And if you go to any guru and say, okay, what should I do? Most of the time they'll say, oh, follow your passion. But what is that passion? How do you know what are you passionate about? A lot of times when you complete your residency, we're not very sure as to what really we like or whatever we like. I mean, you may like to be a basketball player, but your height may not support you to be a good basketball player. That means that while your aspiration is there, but you probably will not be able to fulfill it. So these are the questions, and there is no real one-liner like a chat GPT saying, oh, this is passion and this you follow it. But most of the time, if you keep at it, whatever you're doing well. In most instances, you will get that feeling that this is what I want to do, and if you keep at it, probably you'll excel at it. So essentially, what are the options which are available in clinical ophthalmology after you complete your residency? Beyond clinical ophthalmology, but within ophthalmology, and beyond ophthalmology, what all you can do. So, how do you choose your interest in the specialty? Of course, the commonest and the most popular one would be cornea, cataract, refractive, because that's something which is more accessible, where you have many patients, especially cornea refractive, and it appears that probably these specialties will get you more money. But then obviously beyond a point in time, it becomes sort of a single line, a monotony, because you essentially become a technician of cataract refractive. I'm not talking about immediate, but let's say after you've done 10,000 surgeries, and it is all infrastructure driven. So you need to have those machines and infrastructure to really fulfill your work. What about uvea neuro-ophthalmology? That gives you a lot of intellectual satisfaction, right? Every case is different. You really have to make sure that you have to think about it. You have to spend a lot of time on both these. But then now it has become the specialties which are driven by investigations, and because of medical, legal, and other cases, you end up doing MRI and whatnot for all your cases. You end up, and ultimately, both in uvea and neuro-ophthalmology, we get this a lot from our cornea and cataract and refractive colleagues. Okay, you diagnosed optic neuritis. What next? Okay, you diagnosed traumatic optic. What next? Steroids. Pehle se de do. Why do you have to wait? So ultimately, because right now the way science is, you may not have an accurate or a complete cure for these patients. However, there's a lot of exciting stuff happening in these specialty, like you would have heard of Neuralink by Elon Musk. It appears that if it works, it seemed to be a really transformative technology where you can, the brain communicates with the machine. So essentially, you are able to stimulate or even divert the circuits of the brain. That's what neuro-ophthalmology is all about. What about VR and medical retina? Well, it appears there is a lot of machine-driven and injection-driven practice, and it appears that now there is a lot of money and also good results. But this is what the joke that we give. I don't know whether you have seen this video. I'm sorry, there is no audio here. But here what Sanit they will saying is Tariq pe Tariq, but insaf nahi mila. So you keep giving your anti-VEGF, but there is no vision improvement. So now what about beyond clinical ophthalmology? I mean, you know that these are the options available in clinical ophthalmology. What can you do something where you just stop seeing patients, but you still have control or impact, and you can earn money? Now, there are lots of programs which give you these MBA or allied degrees, and where you do get very respectable job and power in large, nowadays there are a lot of corporate hospitals in eye care and otherwise, and they do require trained administrators. So these MBAs and MBAs from reputed institutions like ISB in Hyderabad or IIM Calcutta or Ahmedabad, they really give you a very good position, and you probably, if you're good, can make a good impact. And there are a lot of ophthalmologists who have become medical superintendents in large hospitals. What about eye care entrepreneur? Can you not start some business yourself? A lot of times we are asking, yeah, I want to start, but I don't have money. Please remember, right now, there is a lot of money which is floating around in eye care. Currently, in eye care, close to 9,000 crore rupees are either getting invested or is available to eye care chain. And this is just the prominent eye care chains. The small chains might have a little more money as well. So in other words, money is available as long as you have the idea, you have the tenacity to follow your idea, and you have that little risk-taking ability to follow it up. There are also a lot of research, fintech, and tech companies who require the medical experts. Now, the tables have turned a little bit. We don't need to know coding to create an app, but they cannot really, the tech people will not be able to replicate what we know. So if they have to create an application or a solution, they require our help. And remember, in these, the remuneration is quite good. It can be up to $100 or $150 per hour. So whatever that's around 8 to 10,000 rupees per hour that you're getting paid if you have one of these companies and you're advising them. But how do you really approach them? How do they know who you are, where they are? And that's where, and I don't have to tell you, I'm sure you all are good at it, the social media really works for you. You should have your own LinkedIn profile. You can put up whatever you know honestly. And how powerful the social media can be, one of our co-faculty, I would like to give you the example of him, Dr. Akshay Nair. So during COVID, Akshay Nair is an oculoplastic surgeon in Bombay, and he handled a lot of patients of mucormycosis. Now, he was regularly posting some of his experiences on Twitter. And it so happened, because of his postings on Twitter, he was invited by CNN, BBC International to give interview on mucormycosis. And here, some person who wanted some help with amphotericin B, so he tagged Narendra Modi, Shivraj Chauhan, AIMS, and Akshay Nair. So that's the power of social media. So what I'm trying to say is that when you use these social media well, just not to scroll your reels, but really do it well, it can help you to build your career beyond ophthalmology. Yes, Dharendra, I think we can open it up for discussion.
Wonderful. So, we yes. So we've tried to cover, academic topics as well as non-academic topics. Before we go any further, is Dr. Yamaguchi here? Is our keynote speaker, Dr. Yamaguchi, is he in the audience? Dr. Takefumi Yamaguchi? Okay. So in that case, we have a little time and we'll take the opportunity to open it up for discussion. Any questions on any of the topics that have been discussed, anything specific or general, whether you're planning to give the examinations or you've already started the way or you're just thinking about it. Any questions are welcome.
Yeah, or comments as well. I'm sure you wanted to say something and we had to interrupt you because we wanted to make sure that all talks are done.
Yeah, I mean, I can answer any questions. Thank you very much. I'm happy to answer any questions about the final part of FRCOphth. That's what I examine. I'm not much involved with part 1 and refraction at the moment, probably not in the future as well. So, but I can answer any questions now if you have any. But tomorrow morning, come at 8 o'clock in the morning if you're interested, 303. And then my colleague, we got 1.5 hour sessions only for this. But if you have any questions, I'm happy to answer.
Yeah. Any questions on any of the topics or even topics which are not covered?
How many of you are planning
No,
to
not you.
how many of you are actually planning to appear for these exams? You're planning to appear. How many of you are now planning after these talks to appear for these exams?
I'm planning not to appear for the exams.
How many of you were planning to, but after the talks have decided not to appear?
Either ways. So at least these talks were eye-openers that even if you want to appear, so residency is the right time that you start planning and, take it forward. Because that's the best time. You'll have enough time and enough number of steps and attempts to, clear it before you are ending up your senior residency. Because once you're detached from your senior residency and academics, then it is difficult to appear for these exams and clear them, right?
Yeah, so they used to say that the ideal time to appear for or start preparation for IIT JEE is preconception. So it's not so bad in ophthalmology, but even for those who are not sure whether they should do ophthalmology, ICO has a foundation examination where you can, I think at that time you could spend 60 Swiss francs and appear for that examination and see if you have an aptitude for ophthalmology to begin with. I don't think you all can have the luxury of doing that, but I think the bottom line is the earlier the better. We've had people who have taken our course, senior doctors, by senior I mean 50 plus, who have successfully completed the examinations. Of course, it came with a lot of stress, effort, and hard work that they've been able to do it. But age is not a limit to give the examination. Obviously, if you're thinking about moving abroad, then the earlier you think about it, the better. Probably, before ophthalmology.
And there is also, I just wanted to say that we just spoke about ICO, that is International Council of Ophthalmology, but now there is also one Ophthalmology Foundation, which is a similar organization. Actually, they had their first exam just last year, and they're also going to offer the fellowship. So you have more opportunities to go abroad. Basically, when you say they offer fellowship, what they do is they sponsor your stay for 3 months, and they connect you with the mentors all over the world, both ICO and IOFF. And otherwise, it's most instances it's an observership, but you do get an exposure to the best in the business.
Dr. Partho, one question on the, we're talking about so much about AI nowadays, and you touched upon it in your talk. But what is the role that you see right now on AI in, ophthalmic training and preparation?
I think it's better not to use the AI tool or ChatGPT or other resources for learning purpose. I think you need to know how to use that, and you need to the command you have to give it to the AI before you do something. So better to do some online course and use it for various creative purpose and other purpose. But I'll suggest that don't use it for learning. Like asking ChatGPT or any other chatbot system to give you a reference or some thing. No, it's always better to go for evidence-based literature search rather than AI.
Yeah, because it can hallucinate. Now, if you give a prompt, very rarely it'll come back and say that, oh, I don't know. It'll come back and give you the answer which will look very authentic, but it might be completely wrong.
Yeah.
So I've given ISO part A and B, and I'm planning after my final university exams to take the parts. Sir, about when I was inquiring about these international fellowships to my seniors, I asked them, they told, I am interested in vitreoretina. They told that this is one specialty that's very difficult to get anywhere outside India for Indian graduates. Is there any truth to this? Or, and eventually I plan to like come back to India because my parents are here and everything. So will these are corporate hospitals more inclined towards hiring someone if they have had a proper hands-on training or an observership from outside, or does that even make a difference because we do have good 3-year, 2-year fellowship programs in India? And like, how does that work specifically to vitreoretina? I wanted to ask in specific to that.
It's an
I think
excellent
in,
question. Sorry, sir.
In retina, it's not a good idea to go for ICO kind of fellowship before you do a long-term fellowship here because it's a surgical branch. In UVA neurophthal, if you had an exposure, if you go there by observation, you can pick up a lot of points. So I don't think any surgical specialty, these ICO, because they are essentially observation, and it will not make much of a difference if you just do those 3 months and come back. Corporate hospital will not actually will take you.
Yeah, my my basic reason for giving ICO was that it surpasses that FRCS Part A and B, and it gives FICO also and FRCS eventually we can. So that was my main purpose of giving ICO. Plus eventually, like, even if some license exam is required from specific, that I'll clear. Like, point is whether there is truth to the fact, first of all, that VR is difficult to get. That is the first part.
There are a lot of seniors that we know of who have gone for ICO fellowships in vitreoretina. I think you can.
Not in vitreoretina per se, but in medical retina or
Medical retina.
teaching they have gone. Vitreoretina per se, you will not get any hands-on experience. So you'll get only observership in the ICU.
Even in other exams, sir, like any other exam for that matter, let it be, okay, ICO will remove. For example, even if I take MLE and eventually apply to US, they told for international medical graduates and people who have done their residency, I don't want to repeat my residency. They told either you repeat your residency in US. But getting vitreoretina is difficult. Is there any truth to that particular statement?
That is true.
Yes.
Because even for the residency, as you said, you will have to do a 5-year residency, and then subsequently still you are an Indian medical graduate. So you will have a lower precedence over a US graduate. So even after that, you will still have this thing. And VR fellowships in the US are extremely competitive in any case.
So the US fellowship is through a website called SF Match, and through that, even for American citizens or native medical graduates as compared to foreign medical graduates, it's very competitive to give in. So my understanding of your question is, leave out the licensing issues. Going abroad for a surgical fellowship, is it easy or difficult? It's very difficult. More importantly, I don't think in terms of volume, the variety of the cases and the amount of exposure and hands-on work that you will get in fellowship programs in India is even comparable to that. So even if you were to get it, I would implore you to take it, do a 2-year specialty retina fellowship in India, and then go there abroad for even then at that point, a 3-month observership is enough to polish the edges.
I will go one step further, Akshay. It's not just the surgical specialties. If you end up wanting to do uvea or neuro-ophthalmology, the number of cases that you will see in a 1 year or 1.5 year or 2-year fellowship in India will still beat the number that you will see abroad. And secondly, the going abroad after your fellowship is just adding some value or adding a separate sheen, a different layer to your teaching and understanding. It's not going to substitute for a long-term fellowship in India, which offers you a plethora of experience, both medical and surgical.
Thank you so much, sir. Thank you.
I think to sum it up, after your fellowship here, you know exactly what more you want to see, and you know what you don't want to see any more of. So that can help you tailor and choose the place where you want to go for your observation.
Yes, specifically for surgical retina, you could, after finishing a VR fellowship in India, you could have an ocular oncology fellowship abroad, or you could have a separate retinoblastoma fellowship abroad, if these are niche areas that you want to further focus on. So surgical VR in India would then be a launching pad for further niche super specialization.
Thank you, sir. Thank you, sir.
Good afternoon, sir. Good afternoon, ma'am. So I wanted to ask, recently UK stopped entry into ST3, so we become overqualified after completing the FRCOphth exam to join UK specialty in ST3. Does that have any effect? I just finished my residency. I have given FRCOphth first exam. I'm planning to give the second exam in June. But I heard that entry into ST3 is stopped.
No, you want to enter into the UK postgraduate training exam?
but yeah, we are overqualified after doing residency
I'm
here.
not sure about that aspect, sir. Would you want to add to that?
So in the UK, you have two paths to training. So what you're talking about ST1 to ST7 is what the local graduates do. So after F1, F2, they apply, they select an F1, and then 7 years course and become fully qualified. So there is one or two places where you can get in middle, so F2, F3, F4, but that's the route is extremely difficult. For practical purposes, that doesn't exist. But the other alternative route, where if you show the competency about whatever is required, if you do all that competency, that's called Caesar route. So, and then you can do that. So that's the path I think all of you should concentrate on. So just ignore the ST1 to ST3. Now, in terms of answer to your question, what was your question again about the VR fellowship? Yeah. So let him ask. What was the question?
Following that, now I want to do a VR specific because I am just.
You want to do a VR fellowship?
I want to, because
Have
I'm
you done
nearing.
VR fellowship here already?
No, sir. I'm nearing completion of my residency. I'm
Okay,
sure I
so
want
general
to go
residency, and you
it.
want to do VR fellowship.
Yes, sir.
So
yes,
what's
sir.
your question?
So my question to the panel was whether, like what I've heard from my seniors who are either doing an observership outside or doing a hands-on surgical training in any other department, they told getting a VR fellowship is one of the most difficult tasks in ophthalmology outside. Being an Indian medical graduate, and even since I've completed my residency from India, either they want us to repeat the residency all over again in their own country. Directly getting in is virtually impossible kind of thing in any country.
So getting into any fellowship is difficult, and VR fellowship is more difficult than other. That is true, but it's not impossible. And especially, I know if you work hard, you can get any fellowship. The thing to know is then how to get it, that you get the fellowship with the minimum effort, minimum time. So first of all, I think one of the panel members said that for the surgical fellowship, doing observership is complete waste of time. By observing, by watching a video, we're not going to become good VR surgeons. So for VRTs and medical fellowship, some benefit is still not the same benefit, but for surgical specialty, that's complete waste of time. Now, to practice as a doctor, any country, you have to have a registration. So in UK, it's the GMC registration. So if you do FRCS, any of the 4 FRCS, you get the registration. Then is a question how to get the fellowship. Now, if you do a residency from here, in this country, getting fellowship is not difficult in the UK. So in the UK, let's say there are 2 levels of fellowship. It's a VR fellowship, but if you get into the DGH, that's relatively easy. You won't have much difficult. And then after doing 1 year of that fellowship, the Moorfields is where you want to do a fellowship. There you will get the experience you'll never get anywhere else in the world. There's no comparison, even in the US. The amount of volume they get through the Moorfields, but they won't accept anyone who has got previous VR exposure. So what I would suggest for you, to complete the residency here, get one fellowship, FRCOphth if possible, get any VR fellowship in the UK, and then second year or third year, 2 years, do a Moorfields fellowship. So that will be, let's say, 2 years to get FRCOphth. If you get FRCOphth from here, then 1 year of fellowship, let's say VR standard fellowship, and 1 year of Moorfields fellowship, and 2 years of time, then you can tackle any VR problem, and you can walk into any job in the world, not only in the UK, in Australia, US, New Zealand, etc. Once you're well trained, and you can show you're well trained, you can walk into any job.
Thank you so much, sir.
Thank you to all our participants. We are running out of time. So we are available during the course of the day, and during the next few days. You're most welcome to meet any of us. So I thank all of the audience members for attending this symposium, and all of my co-panelists and co-instructors, and the All India Society for this opportunity. Thank you, everyone.